I thought today we'd start off the program talking about heart disease, the leading cause of death in this country and around the world, despite trillions of dollars spent on supposedly preventing it, supposedly eliminating it. The alarming statistics are at least 1 in 3 Americans is dealing with some aspect of cardiovascular health, some negative aspect of cardiovascular health. And this has all occurred under the watch of the American Heart Association. It's all occurred under the watch of statin-making drug companies and doctors' frantic efforts to supposedly eradicate it. When it comes to causes, and that's really what it's all about if you want to prevent heart disease, when it comes to causes, there's lots of them. Respiratory problems, digestive problems, emotional stressors, mental stressors. But nothing beats plain old sugar when it comes to the enemies of heart health. There is a major, major connection between diabetes, what's called dysglycemia, that is messed up blood sugar, as all diabetics know, and cardiovascular symptoms. And that includes, by the way, high blood pressure and elevated cholesterol. There's also a particularly important connection between fructose, fruit sugar, and heart disease. Now keep in mind, fruit sugar is not as much of a problem when it's in fruit, because fruit contains vitamins and fruit contains minerals and fruit contains fiber that helps the body process the fructose. I'm not saying it's okay to eat lots and lots of fruit, because fruit's still a major source of sugar and of fructose, and that's not a good thing. But eating fruit can still be better than drinking fruit juice or eating high fructose corn syrup or other places where we get fructose. The problem with fructose and the problem with sugar in general is it's highly, highly addicting, and this is why it's so hard to get off of sugar. It's just as addicting as cocaine and just as addicting as heroin, believe it or not. Yes, sugar is just as addicting as cocaine, and this is why withdrawing from sugar is so darn difficult. Withdrawing from sugar, eliminating sugar, or at least reducing our intake of sugar, as important as it is, represents a stress on the body. It represents a stress, for most people, on an already stressed out system. And in this way, fructose and the potential problems associated with fructose are better than adding another stress in the form of withdrawal. So what can you do? Well, one of the easiest ways to withdraw yourself off of sugar is to make sure you're using sugar correctly, to make sure you've got the nutrients that are important for helping your body process sugar. And of course, I'm talking chiefly micronutrients. I'm talking especially chromium and vanadium, which you get in the longevity sweeties. I'm talking about potassium and magnesium and calcium and sodium and chloride, what we call the electrolytes, super important for helping the body process sugar. You get those in the Beyond Tangy Tangerine. And of course, nothing beats the B complex of vitamins, especially vitamin B3 and vitamin B1, niacin and thiamine, for helping the body process sugar. Where do you get vitamin B1, vitamin B3, the B complex? Where do you get your electrolytes, your magnesium, your calcium, and your sodium? Of course, I'm talking about the Beyond Tangy Tangerine. If you're one of those folks that can't seem to get yourself off of the sugar, can't seem to wean yourself off of high fructose corn syrup or fruits or desserts or soda pop, you'd be really smart to start sipping on the Beyond Tangy Tangerine. Put a little bit in some water, sip on it slowly, dilute it to the point where you like the flavor of it, and sip on it all day long, especially sipping on it when you would ordinarily be snacking on sugar. By the way, fructose is especially a big problem for the liver. It's especially a big problem for folks who are dealing with fatty liver disease, which means that not only will your sweeties and your Beyond Tangy Tangerine help you withdraw off of sugar, they're also going to help you with your liver. And we know 1 out of 3 Americans is dealing with a liver health issue. It's a big, big problem, folks, fatty liver disease. Doctors will say, oh, don't worry about it, it's just normal. A little bit of fatty liver isn't going to hurt you. Well, guess what? Your liver's not supposed to be fatty. Your liver's supposed to be perfectly healthy and pristine. And one of the easiest ways, one of the quickest ways to restore your liver back to health is to wean yourself off of sugar and get yourself on a good nutritional supplement program. Controlling fructose, paying attention to liver health, paying attention to digestive health. These are far more important strategies than lowering blood cholesterol with a toxic statin drug, or using a beta blocker, or using a calcium channel blocker to force your blood pressure to stay in control. And on top of all that, you're going to save a lot of money. You're going to eliminate toxicity, or at least reduce the toxicity from prescription drugs, and you're going to save a lot of money from spending it on doctors and prescription drugs. All you need to do, folks, if you're dealing with heart disease, or for that matter, if you're dealing with any chronic degenerative disease, is change our lifestyle choices around what we're eating, and especially around nutritional supplementation. If you're dealing with heart disease, if you're dealing with cardiovascular health issues, if you're dealing with high blood pressure, if your doctor told you got elevated blood cholesterol or elevated blood fats, please get yourself on the Healthy Start Pack. Get yourself on the Beyond Tangy Tangerine. Start sipping on it all day long. Get yourself on the Ultimate Essential Fatty Acids or the EFA Plus. Do 3 in the morning, 3 in the afternoon, and 3 at night. Get yourself on the Beyond OsteoFX. We call that the Healthy Start Pack. And then throw in the sweeties, especially when you're done with your meals, and especially when you're done with high sugar meals or high carbohydrate meals or high fructose corn syrup containing foods. All right, I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie program. Our number, 831-685-1080, 888-379-2552, toll free. If you've got questions about health or nutrition or prescription drugs or the longevity products or a success story, we'd love to hear from you, 831-685-1080 or 888-379-2552. You are listening to the Dead Doctors Don't Lie program on the ZBS Radio Network. We'll be back right after this. Don't go away.
You may have heard about the 90 essential nutrients or the Mighty 90 needed for good health. But with all the products out there, what exactly are they talking about? The Mighty 90 is 16 vitamins, 12 amino acids, 60 plant-derived minerals, and 2 essential fatty acids. So now you know. But with all the products you see and hear advertised, what exactly do you buy to come up with the Mighty 90 and the right ratios to promote good health? Longevity has made it easy with the Healthy Start Pack, which contains 1 canister of Beyond Tangy Tangerine Vitamin and Plant-Derived Mineral Complex, 1 bottle of Bone and Joint Enriching OsteoFX Plus, and 1 bottle of EFA Plus Essential Fatty Acids, all in the proper ratios to promote good health and vitality. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Longevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Greetings, Doug.
Good to have you back on the show. I've got a CNN story here headlined, How to Get Blood Pressure Down to 120. You see, doctors have long known that systolic blood pressure below 120 was considered normal and meant a lower risk of heart disease and kidney problems. Recent findings from the National Institute of Health study suggest that it's worth treating patients in that pre-hypertensive gray area of 120 to 140 in order to bring them down into the normal range. And according to Dr. John Bisognano, a professor of medicine at the university.
Say that again, Doug?
I'm not going to try it. He's a professor of medicine at the University of Rochester Medical Center and the president-elect of the American Society of Hypertension. He's quoted as saying, "This is notable because there are a lot of people out there with blood pressure in the 130s that we might previously have left alone. But if the results of this trial are as we think they are, it might be a reason to try to get them to 120. And then they suggest several ways. They say medicate. Many people have to take a blood pressure medication just to stay close to the 140 mark to get down.
Horse hockey.
Yeah, they say to get down to 120, these people may have to take more blood pressure medications, such as ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. Another suggestion that they have is to lose weight. They say weight loss can lower blood pressure about as much as taking a single blood pressure medication. So losing about 9 pounds can reduce the systolic blood pressure by about 4.5 points. And maintaining weight loss of about 7 pounds for a year could even lower it down about 11 points. And then they say exercise. According to the American College of Cardiology and the American Heart Association, they recommend about 2.5 hours a week of medium intensity physical activities such as jogging, swimming, or dancing. I'll pick the dancing. And they go on to say the study found that 10 weeks of moderate exercise, such as walking or cycling for an hour 3 times a week, reduced systolic blood pressure by about 5 points. They say scale back on the salt. One of the most important dietary changes some people can make is to lower blood pressure is reducing salt intake. Many of us consume 9 to 12 grams of salt a day. According to the American Heart Association, they recommend 3 to 4 grams a day. Eat more fruits and vegetables. Dietary approaches to stop hypertension, or DASH, was developed by the National Institute of Health. The DASH diet is high in fruits and vegetables and fiber and low in sodium. Snack on chocolate. Research suggests that people who ate more dark chocolate over a period of 2 to 8 weeks had lower systolic blood pressure than by about 2 points. They say the antioxidants, flavonols, may help dilate arteries. Don't binge drink. They say alcohol reduction interventions can reduce systolic blood pressure by about 4 points among people who consume 30 to 60 drinks a week. Meditate. That meditation practices that aim to improve focus and reduce anxiety may also lower your blood pressure. Transcendental meditation can reduce systolic blood pressure by about 5 points. So there you go.
You know what's cool about lowering your blood pressure and about blood pressure in general? Hypertension is a sign of a body in distress. And that distress can be emotional distress or mental distress. You know, there's always jokes about people's blood pressure going up when they get angry or they get into a fight with their husband or with their wife. It's kind of like a stereotypical funny thing that your blood pressure goes up when you're under stress. Well, it's not really funny. It's serious. When we're under stress, our blood pressure goes up. But what that means is, this is so cool, Doug, anything we can do to anti-stress, anything that we can do that's fun and that's relaxing is going to lower your blood pressure. I didn't see a hot tub on that list. Do you know taking a hot bath or a hot shower is a great way to lower your blood pressure? Even a back rub or a foot rub or a hand massage is a great way to lower your blood pressure. Sitting on the couch and doing nothing is a great way to lower your blood pressure. And my all-time favorite way to lower blood pressure and lower really quickly, well, I'll tell you what it is when we come back from our break. I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie radio program. Our number 831-685-1080. or 888-379-2552. We got a couple lines open for you. If you have questions about the longevity products or health or nutrition or prescription drugs, or if you just want to comment or share a success story, 831-685-1080 or 888-379-2552 is our toll-free number. We'll take a break and come back with you and your phone calls and more good health information on the Dead Doctors Don't Lie radio program right after this. We're talking a little bit about hypertension and high blood pressure. Some 80 million Americans are dealing with high blood pressure issues. And you know, doctors will say that most high blood pressure is essential hypertension, meaning they don't know what causes it, meaning it's just part of your makeup, it's part of your nature. And this is why they use these toxic drugs. And I'm telling you, calcium channel blockers and beta blockers, which are the two most important classes of antihypertensive drugs, are the most they're not the most deadly drugs, but they're among the most deadly drugs. Why? Because the body doesn't want to play around with its pressure. This is very important. How much pressure, the pressure of the blood as it circulates through the body is tightly regulated. And the only way to pharmacologically intervene to manipulate the pressure of the blood as it travels and makes its way through the 50,000 miles of circulatory vessels is to use some heavy-duty poison. The diuretics tend to be a little less poisonous. ACE inhibitors, as you mentioned, Douglas, they're not quite as bad, but those beta blockers and calcium channel blockers are super deadly. Here's the thing. When you have high blood pressure, you've got the manifestation of a stress response, and that stress response can be due to sugar, it could be due to insulin, it could be due to emotional and mental stressors, and it could be due to digestive health issues. Oh yeah, and it could be due to low blood oxygen. All of this tells you that if you want to lower your blood pressure without drugs, what you got to do is you got to figure out how to tell the body all is right in the world. You got to figure out how to tell the body to stand down its defenses, to relax. All the fun things in life will lower your blood pressure. A hot tub lowers your blood pressure. A hot shower lowers your blood pressure. Meditation lowers your blood pressure. A back rub will lower your blood pressure. A foot rub will lower your blood pressure. A massage will lower your blood pressure. And one of my all-time favorite ways to lower blood pressure is something we could do just sitting on the couch watching TV. Slow, deep breathing. One of the reasons that why blood pressure goes up is because the body is attempting to redirect oxygen flow. So by sitting on the couch and practicing your slow, deep breathing and oxygenating your blood, you will naturally drop your blood pressure. And you can prove this to yourself if you have a blood pressure cuff. Just sit on the couch, take your blood pressure, take a baseline reading, and then practice some slow, deep breathing. In through the nose, 15 seconds. Out through the nose, 15 seconds. 2 breaths a minute. 1 breath every 30 seconds. And do it for 2 or 3 or 4 minutes. You'll notice your blood pressure will drop like a stone. Without drugs, without toxicity, without side effects, without going to the doctor. It's as simple as that. And that's the cool news about nutrition and nutritional supplementation. We are designed to be healthy. We are not designed to have high blood pressure. We are not designed to be overweight or obese or have dysglycemia, messed up blood sugar, autoimmune diseases, or any of the thousands of different ways the body breaks down. When it comes to hypertension, the simple things. And don't forget nutritional supplementation, especially with the B vitamins, especially with the Beyond Tangy Tangerine. And by the way, your Sweeties, which is awesome for lowering blood sugar, is also going to help you lower your blood pressure, and it'll help you lower your blood fats too. Get yourself on a nutritional supplement program, correct digestive health issues, practice your slow, deep breathing, and lighten up and relax. These are the simple things that will allow us to access our God-given ability to heal and our divinely mandated ability to stay healthy. If you got questions about health or nutrition or prescription drugs, we want to hear from you. 831-685-1080 is our priority line number. 888-379-2552, toll free. I'm Pharmacist Ben along with Doug Winfrey, sitting in for Dr. Wallach today. We're coming back with your phone calls right after this break. Don't go away.
This is the ZBS Radio Network.
All right, we're back on the Dead Doctors Don't Lie program. I'm Pharmacist Ben along with Doug Winfrey, sitting in for Dr. Wallach today. Thank you for joining us. 831-685-1080 is our priority line number. 888-379-2552, toll free. If you're tired of paying big bucks for your prescription drugs, if you're tired of dealing with side effects, fatigue, and depression, and you want to get on a good nutritional supplement program, we can help you do that. If you want to wean yourself off the meds you're on and get on a supplement program like the one designed by Dr. Wallach, we can do that. 831-685-1080. 831-685-1080 or 888-379-2552, 888-379-2552. Let us help you understand. Let us show you how easy it is to get off your meds and get on a good nutritional supplement program, no matter what your health challenge may be. All right, time to hit the phones. Who's first on the line? Douglas?
Well, let's head to Illinois, and Brenda, you're on with Pharmacist Ben Fuchs.
Greetings, Brenda.
Hi, how are you?
I'm good. What's going on?
Well, I got a blood test taken, and I got the results, and I wanted to get advice on it.
Okay.
I took a cholesterol panel. It says a
Here's my advice.
panel.
Pay no attention. But go ahead. You don't have to worry about that stuff. Cholesterol. That's one of the silliest, dumbest things you hear from the medical model is this idea that you got to shut down your cholesterol production. But go ahead. I didn't mean to interrupt, Brenda.
Yeah, because that's okay. My doctor is really on me about this. My cholesterol HDL was 232, and the LDL cholesterol was 162.
Did he tell you why? Did he tell you why your cholesterol's? It's not even that high, but did he tell you why it's high?
Well, I haven't seen her for this second test within a year. I haven't seen her for these results. I just got these results in the mail.
Okay.
So I wanted to find out what to do about it.
Okay, let's talk about it right now.
I have one more. HDL cholesterol was 183. And then my MCH was 26.1, which they said was low. And the MCHC was 31.6, and they said that was low. and my RDWs were 17.3.
All right, these are numbers. Brenda, sweetheart, listen, let me tell you something about these numbers. The reason they do these tests is so they don't have to do any science, so they can go to the book. This is what your doctor does, okay? He takes a test, or she takes a test, then they go to a book, all right? And then they look at the book, and they see what the score is compared to everybody else. And if the book says high, you get drugged. And if the book says low, you get drugged. And if the book says normal, you get a brownie point, all right? But you're not a book, and you're not a statistic. You're a human being. And this is my problem with these tests. They're based on normal reference values, Brenda. There's no normal people. Everybody's different. You understand what I'm saying, ma'am? So to drug you, to poison you with a prescription drug, or even worse, cut out parts of your body, or radiate you, or do all the things that doctors do based on test scores is not fair. It's bad science. It's bad medicine. So here's the deal. The reason cholesterol levels get thrown off, and the reason hemoglobin and hematocrit levels get thrown off, MCHC, and these other scores you're talking about, these are blood tests and hemoglobin tests, measurements of the volume of your red blood cells, etc. The reason these things get changed and the reason these things get thrown off is because of things you are doing, because of your lifestyle. Are you with me so far, Brenda? Because I'm going to be more specific in a moment, but I just want you to get the idea. Okay, good. It has nothing to do with a doctor. Nothing. Zippo. Zero. Nada. Doctors have no business playing with your blood. This is your lifestyle. This is the decisions you're making, your eating behavior, your breathing activities, the way you conduct your business. So if you don't want to be poisoned with a prescription drug, you need to control things about how you're living your life, most especially around sugar. And you might want to educate your doctor a little bit and tell your doctor that the reason that the cholesterol levels and blood fat levels and red blood cells get thrown off is largely because of the intake of refined carbohydrates and sugar. Low blood oxygen is definitely involved. Digestive issues also play a part, but by far and away, it's controlling your intake of sugar and using nutritional supplements that help your body process said carbohydrates and sugars. And hang tight, I'll tell you specifically what you can do from a nutritional supplement perspective, so you don't have to use any toxic prescription drugs. And not only will you be able to wean yourself off your meds, you'll be able to wean yourself off your doctor too. All right, I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie radio program. 831-685-1080 is our priority line number. 888-379-2552 toll free. We'll be back right after this. We're talking to Brenda about cholesterol and hematocrit and red blood cells and blood in general. You there, Brenda?
Yes, I am.
Okay, Brenda, here's the deal with the blood, okay? Hypertension, cardiovascular health diseases, blood sugar, all of these involve the sacred space of the blood. The blood is tightly controlled and regulated. Anything that gets into the blood that shouldn't be in the blood is going to mess up the system. That means, and things that don't get in the blood that should is also going to mess up the system. That means, these are your three biggest causes of all blood problems, and that includes high blood pressure and elevated cholesterol. Number one, digestive health issues. Number two, blood sugar. And number three, low levels of oxygen. You can throw emotional and mental stresses into the mix, and none of this involves a doctor or a drug. So here's what you do. First and foremost, get yourself on the Sweeties and the Healthy Start Pack. And the sooner you do it, the sooner you're going to notice results, especially with the Beyond Tangy Tangerine. And the best way to do that is to put some in water and sip on it all day long. Make sure you're using 2 or 3 of the Sweeties after every meal. Make sure you're using 3 of the Ultimate EFAs morning, 3 afternoon, and 3 at night. That alone is going to lower your blood pressure. Step number 2, make sure you're controlling eliminating any foods that cause any kinds of digestive health issues. That means an elimination diet, and the biggest problems are going to be gluten and substances like gluten that are found in grains. You may have to eliminate beans as well. Some people have a problem with those. Heck, some people have a problem with eggs, and some people have a problem with dairy. You're going to have to find out which foods trouble you the most and eliminate those foods. Get yourself on the Biolumin Nightly Essence, 3 in the morning, 3 in the afternoon, 3 at night. It wouldn't hurt you to use the Z Radical or the Fucoid Z. I like that one a little bit better. 3 in the morning, 3 in the afternoon, 3 at night. Ultimate enzymes after all your meals. Last but not least, sit on the couch and practice your slow, deep breathing techniques. If you have a blood pressure cuff, take your blood pressure, then do your slow, deep breathing for 3 or 4 minutes, take your blood pressure again, watch what will happen. That's your proof that you're starting to control your blood fats and to control, if you have hypertension, controlling your high blood pressure and just cleaning up the blood. Hope that helps. You notice there's no prescription drugs that are involved, and you'll notice there's no interfacing with the medical model. You could do it all yourself, Brenda, because the human body is designed to be healthy. Thanks for your call. Appreciate it very much. Let's see who's next on the line. Doug?
All right, let's head to Chicago, Illinois. And Nathan, you're on with Pharmacist Ben Fuchs.
Hey, Nathan.
Hey, how are you?
What's up, my friend? How you doing?
Good, doing well. Hey, I wanted to call in. My wife and I are going to be trying to start getting pregnant here soon, and so she'd like to start taking some prenatal vitamins. Her sister actually works for a naturopath doctor and had some vitamins that she got from her, but those actually make my wife's stomach upset, and so we're going to try to do the tangerine and the OsteoFX for her. But,
Perfect. Don't forget the ultimate EFA. Don't forget the ultimate EFAs. Do the whole healthy start pack.
Yes, yeah, we'll do all three. But I had some questions because I was comparing those vitamins to these ones, and just the differences. And there were a couple of differences on like the K's, the thiamines and riboflavins. And I'm wondering, does it matter what type? For instance, tangerine is K4, or this is a K1. The thiamine is a thiamine mononitrate versus a thiamine HCl, and a riboflavin 2 versus riboflavin 5.
No, they're not. I sound like a little bit of confusion there. Okay, first of all, there's different forms of vitamin K. That's correct. But as far as for your wife, as far as prenatally, kind of to make sure your wife is loaded up with nutrients, that's not going to make much of a difference. There's a slight difference between the types of vitamin K. The B complex, which you're reading, are the activated forms of the B complex versus the inactive forms. The inactive forms need to be activated, and sometimes in nutritional supplements you'll see them activated for you. So the only differences between those two B vitamins are the active form versus the inactive form, and that doesn't make much of a difference. If you're healthy, you'll be activating them just fine. Vitamin K is a little bit different, but that's not anything you have to worry about too much. Did you have something else?
Yeah, the riboflavin 2 versus 5, again,
there's only two kinds of riboflavin. There's the active form and the inactive form. The 2s and the 5s, I'm not sure where you're getting those numbers from, but those are the activated forms. The inactive form will just be called riboflavin. The activation occurs in your digestive tract anyway. Sometimes in supplements they'll activate them. They'll include the activated form for you. The enzyme, they call it the enzyme activated form. But that's not anything you need to worry about. The Beyond Tangy Tangerine is just fine.
All right, only a couple more. Again, the folic acid versus the mono or whatever it is, the methyl hydrofolate. Again, that's just an activated form.
Not much of a difference. The one form is methylated. It's already methylated. But again, it's splitting hairs. You need to get the nutrients in your system. Your body will activate them just fine, especially under deficiency states.
And I read online, and again, I don't know if this is true or not, but they said that you need to be careful when you're getting pregnant not to take too many of any of like D, E, and K. Is that
nonsense? Nonsense. You can theoretically, if you swallow the whole bottle, you might get a little sick. But as soon as your body would clear that out, and once your body cleared it out, you'd be fine. So theoretically, if you went crazy and swallowed the whole bottle, yeah, you could get a little sick, but you're not going to get toxic or anything like that. But if you take a reasonable amount, which is 5 times the RDA, 4 times the RDA recommended daily allowance, that's not going to be an issue. Doctors will tell you sometimes they'll tell you watch out for vitamin A when you're pregnant. Again, that's nonsense as well. You need all your vitamins, your baby or your fetus. The fetus needs all the vitamins as well. I wouldn't worry about any of that stuff.
Is there anything else besides the tangy tangerine and the OsteoFX and the omega that we should specifically look to have extra amount of?
Absolutely. 3 things. Okay. Number 1, the biolumin nightly essence. Mom's gut bacteria, the bacteria that live in mom's gut, are going to play a very, very important role in the health of the fetus, especially in terms of the baby's digestive health. Number 2, the Slender FX. It's super duper important that she gets enough protein. The Slender FX is a whey protein, soy protein supplement. It's important that she gets enough protein. And number 3, because obviously if she doesn't digest her food or absorb her nutrients from her food, she's not going to get the benefits of nutrients from food. That's why the ultimate enzymes can be very, very helpful. Make sure she uses a little bit of apple cider vinegar with her ultimate enzymes with meals. And good luck. Appreciate your call.
Hey,
congratulations too. Yes?
Let me ask you one more question.
Sure.
Okay, regarding the Beyond Tangy Tangerine, regarding the trace minerals, I know that there's some trace minerals in there, such as, I've seen in there like arsenic and things like that. My guess is in the colloidal form that they don't.
You are right on, my friend. How did you know that? Have you been listening?
I do a lot of studying. I'm actually Nathan's father-in-law, and this is for my daughter, so we're doing a lot of studying here. So
who's your father? I didn't hear what you said. You're who?
I'm Nathan's father-in-law. We're talking about my daughter here, so we're doing a lot of research. So.
Well, good for you. You hit the nail on the head. When you see the colloidal mineral, anything that's colloidal, this is what Dr. Wallach's brilliant insight is that plant-derived minerals are not the same as ordinary minerals. A plant-derived mineral has been manipulated by a plant so that it's usable by the body and so that it's non-toxic. When a plant complexes these minerals, it turns these minerals from rocks into powerful nutrients and at the same time eliminates any potential toxicity. This is the beauty of plant-derived minerals or colloidal minerals. And this is one of Dr. Wallach's brilliant insights. He's had many, but one of Dr. Wallach's brilliant insights was the advantages of plant-derived colloidal minerals. Thanks for your call. Appreciate it, and good luck with everything. Okay. Who's next on the line, Doug?
All right, let's head to Boulder, Colorado, and Kimberly. You're on with Pharmacist Ben Fuchs.
Kimberly in Boulder.
Hi,
Kimberly?
hi. No, it's actually Colorado Springs, but that's okay.
Okay. What's up, Kimberly?
Yeah, so I have CRPS, otherwise known as RSD, in my feet.
Okay.
And every neurologist and doctor I've been to have said that it's because of the surgeries that triggered that.
It could be, but it doesn't mean that you have to be condemned to it. Let's talk reflex sympathetic dystrophy or complex regional pain syndrome. I love these names. Complex regional pain syndrome. That means you're just hurt a lot. Reflex sympathetic dystrophy means your muscles are messed up. Hang tight. We'll finish up when we come back. I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie radio program. 831-685-1080 is our priority line number. 888-379-2552 toll free. We'll be back right after this. Don't go away. All right, we're back on the Dead Doctors Don't Lie program. Doug Winfrey and Pharmacist Ben here sitting in for Dr. Wallach. 831-685-1080 is our priority line number. 888-379-2552 toll free. We're in Colorado Springs talking to Kimberly about reflex sympathetic dystrophy. That's pretty miserable, Kimberly. I've seen folks. It's awful. So it's also known as CRPS, as you said, complex regional pain syndrome. It just means you got a lot of pain. All right. Where does pain come from? Pain comes from the pressure that's pushing against the nerves. That's what pain is, you guys. It's inflammation pushing against nerves, stimulating the nerves. So what do you got to do? It's also jumpy nerves, unstable nerves. So here's what you got to do. First of all, the cause of all inflammation, well, most inflammation is going to be digestive issues. So Kimberly, my dear, do a food diary. Write down everything you eat, and then write down how you feel after you eat said food. Foods that cause digestive distress need to be eliminated. If you want quick relief from your pain, stop eating. Fasting, in other words. If you want to do a complete fast, that's great. If you want an easy, handy-dandy fast, do a Suero V cleanse. Get yourself some Suero V Gold. Do half a bottle every hour, six bottles in a 12-hour period, half a bottle every hour. It'll help you get over the hump of a fast. Sometimes you got to get into the fast before it becomes easy. The first couple hours of a fast sometimes are difficult. The Suero V cleanse makes that easy. So you can do a Suero V cleanse. You're going to notice quick results when you stop eating from the pain. Now, clearly you have to eat again. So when you start eating again, eat very carefully. Pay attention to your flare-ups, and you pay attention to digestive symptoms and pay attention to flare-ups and pain with foods, and those are foods that need to be eliminated. Gluten-containing foods are always going to be a problem. Eggs can be a problem for some folks. Dairy can be a problem for some folks. Beans can be a problem for some folks. Are you with me here, ma'am?
I'm here. And,
okay, good.
Yeah, and I've
well, let me get a couple more things.
Okay.
Oh, you have done this in the past? You've done a food diary in the past?
Yeah, I did, and nothing seems to change. Like,
Well-
I'm really tolerant to most. I mean, I'm sure there's something that's causing
There's
it.
got to be something. You got to find it.
There is,
This is
but I
homework.
can't find it so far.
Well, it's there. Keep looking. Keep looking. And
Yeah,
also,
yeah.
what you can do from a more that's from the negative sense. That's going to be elimination. But from a positive sense, what you're going to put into your system, get on the Biolumin Nightly Essence right away. 3 in the morning, 3 in the afternoon, 3 at night. Make sure you're using your Ultimate Enzymes with all your meals and also on an empty stomach. This is so important when it comes to understanding how to use nutrition. It turns out that the Ultimate Enzymes are pain relieving. Not just for RSD, but for dental pain, for migraine headache pain, for back pain, for post-surgical pain. The Ultimate Enzymes are pain relieving. So using the Ultimate Enzymes can help. You might also want to try the CM capsules. That might help you too. Of course, you're going to make sure you're on the Healthy Start Pack. Sip on your Beyond Tangy Tangerine. Take 3 of the Ultimate EFAs in the morning, 3 in the afternoon, 3 at night. And then also the Beyond OsteoFX, 1 capsule in the morning, 1 capsule at night. Last but not least, under conditions of relaxation, activating the body's relaxation nervous system, the body has a tendency to heal, and you'll find that you're relieving pain. Using slow, deep breathing techniques are wonderful for pain relief. Slow, deep breathing techniques can help with RSD and with CRPS and with really all stress-induced issues. Hope that helps you, Kimberly. God bless you. Thanks so much for your call. That's just miserable, Douglas. Reflex sympathetic dystrophy, just terrible, terrible pain, and it does occur post-trauma or post-surgery. All right, let's see if we can get one more call in.
All right, let's head to Minnesota. And Bruce, you're on with Pharmacist Ben Fuchs.
Hey, Bruce.
Hi, how are you?
What's up, my friend?
I started in 2010 with stage 1A lung cancer.
Okay.
And had a lobe removed, and then I had a wedge resection in 2013.
Okay.
And now I'm at 4 with 3 lesions. And from the result of the radiation and chemotherapy, my blood pressure is up and my pulse is way up.
Okay, your body's freaked out. Basically, you got a body that's freaked out. We got to calm the body down. You know, we've been talking about oxygen a lot today. We talk about it all the time, really. And we've been talking about it as it relates to the blood. But oxygen is also anti-cancer. You know, cancer can't survive in oxygen. Cancer is killed by oxygen. Even if you were to do ozone therapy, where you inject oxygen right in your blood, that's wonderfully anti-cancer. So all the same things that we talked about on the program. Make sure you're relaxing the body, activating the relaxation response, the parasympathetic nervous system. If you're technically minded, make sure you're deep breathing. Cancer hates oxygen. Cancer loves sugar. So make sure that you're working on your blood sugar as well. Use the Healthy Start Pack. Use the chromium, the sweeties, the chromium, vanadium, and then also probably wouldn't hurt you to get on the Ultimate Selenium. Thanks for your call. Sorry, we just ran out of time. All right, that's all the time we have for today on the Dead Doctors Don't Lie radio program. For Doc Wallach, for Doug Winfrey, for all the folks at the ZBS Radio Network, I'm Pharmacist Ben. Have a wonderful, beautiful, awesome, spectacular day. We'll talk to y'all later, folks. Bye for now.
Dead Doctors Don't Lie, the talk radio program, is a copyrighted production of the ZBS Radio Network. Broadcast of all or part of this program by any station without a valid license from ZBS Radio Associates will result in civil liability for and criminal prosecution of that station under applicable United States federal copyright laws. Broadcast licenses may be obtained by calling the ZBS Radio Network at 831-477-1999.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
Fish has been thought of as a brain food for eons. But it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Youngevity has developed the perfect supplement in SmartFX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try SmartFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.